accusations against the national security law for Hong Kong SAR, and even talks about changing the arrangement for British national overseas passport holders in Hong Kong. These moves constitute a gross interference in China's internal affairs.
British Foreign Secretary Dominic Raab rejected that criticism. The BBC's Paul Adams has more.
The ambassador tends to speak fairly bluntly, but you can sort of feel in his voice a sense that UK-China relations are kind of fraying by the day. He said that when the principles of sovereign equality and non-interference are violated, the relationship will, in his words, suffer setbacks. You know, he insists that human rights in Hong Kong will be respected. He says that no country in the world would tolerate the kind of protests that have been going on in Hong Kong for more than a year now. And he quoted at one point the former National Security Advisor to Jimmy Carter, Zbigniew Brzezinski, who said many years ago, if we make China an enemy, China will become an enemy. And there was clearly a very strongly implied and very thinly veiled warning there.
Paul Adams with that report. The UK government is said to be drawing up plans to strip Chinese telco Huawei from Britain's 5G networks by the end of the year. The Chinese ambassador says such a move would damage the UK's reputation as a business-friendly, open, transparent environment. A white woman who called police to say a black man was threatening her life in New York's Central Park is now facing misdemeanor charges. Amy Cooper called police when the man asked her to put her dog on a leash. The BBC's Stephanie Prentice has been following the case.
These charges of falsely reporting an incident have been filed by Manhattan's DA after public outrage over the video, with many saying Amy Cooper had risked the life of the African-American man in question by calling the police in a distressed manner after he'd asked her to put a dog on a lead in a pet-controlled area. Here's what happened just after Mr. Cooper made his request and Amy Cooper was walking towards him.
Please don't come close to me.
Sir, I'm asking you to stop recording me.
Please don't come close to me.
Please take your phone off.
Please don't come close to me.
I'm taking pictures and calling the cops.
Please call the cops. Please call the cops.
I'm going to tell them there's an African-American man threatening my life.
Please tell them whatever you like.
The context of this encounter is also very important. It happened in May, on the same day as the death of George Floyd at the hands of a white police officer. And many said this gave a sharp insight into the potential power dynamic in a confrontation between a black man and a white woman.
There is an African-American man. I am in Central Park. He is recording me and threatening myself and my dog. I'm being threatened by a man in the ramble. Please send the cops immediately.
Amy Cooper could now face up to a year in prison if she's convicted.
Stephanie Prentice reporting. Police in Zimbabwe have arrested 12 nurses during a protest outside a hospital in the capital, Harare. Health workers have been holding demonstrations to demand they're paid in US dollars because inflation of almost 800% is eroding their salaries. The coronavirus lockdown, put into place to slow the spread of the disease, has accelerated political tensions and deepened Zimbabwe's economic crisis. Theatres in the UK have been thrown a lifeline in the form of a cash injection to the tune of nearly $3 million. The pandemic temporarily brought the curtain down on many of the country's famous venues, and while they've been able to reopen with the relaxation of measures this week, they still face a significant fiscal hole. The Royal Albert Hall in London warned last week it could go bust before its 150th anniversary next March, and has welcomed this rescue package. Here's the BBC's Will Gomberts.
Last week, theatres across the country were desperate, saying they were cash-strapped and on the verge of bankruptcy.
I'd rather have a pint!
What a difference a weekend makes. The tone has dramatically changed after the government announced a £1.5 billion rescue package for the arts and entertainment sector.
It shows real vision on the part of the Chancellor of the Exchequer and the Secretary of State. It's urgently needed, and I think it's fantastic that they've really recognised the huge workforce and the importance to Great Britain.
There you go. Roar of the crowd.
The Chancellor and the Culture Secretary were treading the boards at the Globe in London, promoting their sizable cash injection, which will save many jobs and venues, but not all.
Sadly, not everyone's going to be able to survive, and not every job is going to be protected. And sadly, we will, I have to be honest with you, of course we'll see further redundancies.
Oh no, there won't probably be any panto this year. The government's financial lifeline will help theatres survive missing out on their annual cash cow this Christmas. But the money is only a short-term measure. What venues really need is permission to reopen to full houses, which means a relaxation in the social distancing rules. Without that, they might well be back at the Chancellor's door in a few months' time, asking for another £1.5 billion.
The BBC's Will Gombertz with that report. And that is World Watch for today. Back to you, Marnie.
Thanks, Annabelle. And that's Midday Report, Te Pūrongo o Te Pautūtanga for today, Tuesday, July the 7th. You can listen back to all of our interviews and our business, sport and rural news at our website, rnz.co.nz/Midday Report. Afternoons with Jessie Mulligan is next, and we'll be back tomorrow with the latest news from Aotearoa and the world. But for now, from the Midday team, kia pai, tō koutou rā.
RNZ News at 1 o'clock. Kia ora, good afternoon. I'm Paul Brennan. Hundreds of returning New Zealanders planning to fly home over the next 3 weeks could face flight delay as a freeze is put on Air New Zealand bookings. The airline has agreed with the government to temporarily halt new bookings to ease the pressure on managed isolation facilities. Its Chief Commercial and Customer Officer, Cam Wallace, says that for customers booked for flights in 2 or 3 weeks' time,
today there are 2 new cases of COVID-19 in managed isolation in New Zealand. There continue to be no cases of COVID-19 in the community. It's been 67 days since the last case of COVID-19 that was acquired locally from an unknown source. Both cases today were returnees who are staying at the Sedema Hotel in Christchurch. The first case is a woman in her 20s, and the second case is a woman in her 30s, and they are both from the same family. They arrived back to New Zealand from Afghanistan on a repatriation flight on July the 2nd. Both tested positive as part of routine testing around day 3 of their stay in managed isolation. That brings our total number of confirmed cases in New Zealand to 1,186. That's the number that the Ministry of Health reports to the World Health Organisation. There is now nobody in New Zealand receiving hospital-level care for COVID-19. The person who was in Auckland City Hospital has been discharged back to the quarantine facility. 2 people are now considered to have recovered from COVID-19, which means that there are 22 active cases of COVID-19 in New Zealand. All of those cases are in managed isolation or quarantine. Yesterday, our laboratories completed 1,641 COVID-19 tests. That brings the total number of tests completed to date to 416,924. I've instructed health officials to ensure that there is an enhanced rate of testing over the next week. In recent days, the number of tests that you will have seen processed in recent days does not meet the government's expectation around the rate of testing that is required. We understand that being in managed isolation can be stressful for people, and we're also aware that people coming back to New Zealand may now have an increased need for support. They may be returning from stressful situations overseas, or they may have had difficulty getting home. People in managed isolation or quarantine have a health and wellbeing assessment on arrival at facilities, which includes questions about their mental health and wellbeing. They're also provided with information on mental health, substance use and abuse, and wellbeing resources, including online therapeutic tools. We'll continue to provide support and adapt the type of support that we provide to meet the mental health and wellbeing needs of the people who are in these facilities. We also recognise that getting home may have been stressful for many people. We recognise the need to show compassion towards the people who are in our facilities, and we recognise that they are all playing their part as our team of 5 million by being in managed isolation or in quarantine. Happy to take your questions.
We haven't had any community transmission for 67 days now. Why is there still a need to test at such a high level? Why are they not meeting your expectations?
We don't need to be testing at the peak level. So you would have seen, at our peak, we got up to around 12,000 tests a day. The health advice that we've had is that we certainly don't need to be testing at near that level, but we do want to maintain a good degree of surveillance across the country so that should anything happen, should there be any undetected COVID-19 transmission in the community, that we pick that up. The advice that I've had from the Director General of Health and the conversations I've had with him is that testing rates more around the 4,000 a day would give us sufficient confidence that if there was any COVID-19 out there, that it would be picked up.
Why are we not testing at 4,000 a day?
Look, that's something that I'm going to be getting into in detail with health officials. We've seen that decline in recent days, and of course I'm not going to second guess the clinical guidance that they have been issuing. That's a matter for the clinicians, but I am going to be very clear with them that the level of testing at its current rate isn't meeting the government's expectations.
Would you like to see for instance, the random community testing come back to make sure that we're getting that testing up, or is it still symptomatic that you want?
Look, I think, again, how to get the rate of testing up is something that I'll leave to the medical experts. They need to exercise their clinical judgments around that. But and the feedback that we've had from those health officials is that that's what they believe we should be aiming for, to ensure that we're picking up any otherwise undetected cases that may be there.
So I understand how it's confusing for the public. We were originally told, listen, if you have a sniffle or a sore throat, get tested. Then last week that changed. Now you're saying we need to test people more. If people are sitting at home not feeling well right now, should they or shouldn't they get a test?
Look, that is a matter for their clinicians. I'm not going to instruct doctors on who should be tested. They do need to exercise their judgment on that. But in doing so, the people who are responsible for the system, so the health officials who oversee the system, need to be making sure that we're still preserving a sufficient rate of testing to be confident that should anything happen, that we would pick that up. Now, of course, there is another layer. There are two other layers of testing that take place. There's the testing that happens in the managed isolation and quarantine facilities, and routine testing of border staff and those working at the border. Because actually, if we have no COVID-19 in the community, we would expect to see, we expect to pick something up before it actually got out into the community as a result of the systems that we've got in place.
If people want to test though, should they be able to get that for peace of mind?
Look, that is a matter for their clinicians. So that's the matter for the people who they are going and asking about that.
There's definitely no capacity issues going on here?
No, there's no capacity issues. We can certainly, as you will have seen, we can get up to around 13,000 a day without too much difficulty if we need to. Of course, what GPs and others will tell you is that there is an opportunity cost involved in that. When they're doing that work, they're not necessarily doing other work that they would need to be doing. But we have surge capacity there if we need to draw on it.
Given the day 3 and the day 12 testing, which if you go back to the review from a couple of weeks ago, they said they didn't have the capacity. So if that's become a new focus, does that have an impact, I guess, on community random testing?
No, I mean, in terms of the lab capacity, the processing capacity, we've certainly got the capacity to manage up to at least 13,000 tests a day and processing 13,000 tests a day. And of course, we're not close to that level at the moment.
So those issues raised in that review 2 weeks ago, where it was very clear that there was a capacity issue, that is no longer the case?
No, the advice that I have had is that issue has been resolved in terms of the ability to process those tests, and we can now do up to 13,000 a day.
The opportunity costs, which you've just mentioned for GPs, so they could be doing other stuff. Does that mean that more CVACs need to reopen so that you can move the testing away from GPs to the CVAC?
No, look, again, I want to say that the government is relying on the clinicians and those overseeing this process to make those kind of judgments about where the testing should take place and who should be tested. But our expectation around the level of testing is not currently being met. So we've been very clear that based on their advice, we want to see a higher rate of testing to ensure that New Zealanders can have confidence that there is no community transmission of COVID-19. So I don't want any New Zealander to think that the reason that we're not seeing COVID-19 in the community is that we're not testing for it. We want to keep testing for it so that New Zealanders can be confident that we continue to keep COVID out.
How many tests did you say there were today?
Sorry, I'll come over here first and then I'll come back to you, Jenna.
How many tests did you say that there were yesterday?
About 1,600 and, I've got the exact number, 1,641. So slightly up on the weekend. We do see if you look at the trend since all of the testing started, we do see a drop-off in the weekends, and we do tend to see that coming back up. So the numbers were slightly lower on Sunday. They have come back up a little bit. They certainly haven't come back to the sorts of levels that we would be expecting.
What have you been told about why your expectations are not being met currently?
Look, I'm meeting with the
Definition, is it the criteria?
Well, look, I'm meeting with the team on Thursday to get into that in great detail, because I do want to be absolutely clear in my own mind about that. It can be a combination of factors: fewer people asking for testing, fewer people presenting, but it can also be that the clinical guidance may well have been one of the change in the clinical guidance may well have been one of the reasons why these numbers have gone down. In which case, I'd be expecting the clinicians to be looking at that again to make sure they can get the numbers back up again.
Has the disease definition changed recently? Could that be a factor?
I think the clinical guidance around who should be tested, certainly my understanding is that it was changed within the last week or so, and that may have had an impact on the rate of testing.
Do you have a plan to test, surveillance test, should there be any local or domestic transmission? Do you have a plan to surge test?
Yes, there is certainly surge testing capacity there, and surge testing that can be done. And you saw that a few weeks ago, actually, when there was a real ramping up to provide New Zealanders the reassurance that they were looking for. And we got up to about 12,000 tests a day, I think, at the peak point, and we were able to do that reasonably efficiently.
The lack of tests being carried out can't be too much of a concern if you're not meeting with health officials for another 2 days to discuss this. Surely if this was a much more pressing issue, you would have met with them.
It's just a reflection of the number of meetings that I have in a day. I already met with them. I met with them just before I came here, where we had the first conversation about that. I've asked them for quite a bit more information, and they're coming back to me on that. I should be getting that back either by the end of today or by tomorrow, and I'll be meeting with them on Thursday. So we have an absolute sense of urgency around making sure that we're getting that. And look, to be frank, as of right now, they are absolutely clear. The government's expectation is that the testing rates should be going up.
Are you contradictory to say that it is up to a clinician to judge whether a test is needed, but at the same time say, hey clinicians, we need you to test 4,000 people a day? That takes the judgment away from them, doesn't it?
No, I don't think it does. It says that there are two things here. There's the question about individual judgments on how individual patients are treated, and there's the question of what overall level of testing should we have as a country to ensure that any undetected COVID-19 transmission was picked up. Now, the health advice that we've received as a government is very clear that we'd be looking at something more around the 4,000 tests a day to have that reassurance. That's our expectation. As to who actually gets selected to be tested, that's a question for the clinicians.
Asymptomatic testing then, because if 4,000 people a day aren't presenting with symptoms, why would you test them?
Well, look, again, that's a question for the clinicians. The advice that they have given us is that around 4,000 tests a day minimum is what we would expect to be able to pick up.
Asymptomatic testing.
Look, asymptomatic people have tested positive for COVID-19. Again, that's just a statement of fact. The judgment as to who gets tested is not one that I'm going to make.
What's the 4,000 based on?
What's that?
What's the 4,000 based on?
Look, that's statistics, basically. The understanding that we've had from and again, this is based on good public health advice, and it's the public health advice that's got us this far. It's proven to be very reliable, is that a testing rate closer to that would give us the reassurance that we're looking for.
Why it's 4,000?
Look, I think it's sampling, and they will need to see some. Well, I guess the other thing is, we do need to see good geographical sampling here as well, so not all in one place. So it's surveillance testing. So it's to make sure that if anything is happening that hasn't been picked up, that it does get picked up.
Are your expectations being met with the use of the COVID Tracer app?
Look, I think we've seen a big uptake in the numbers. So I think there's now 590,000 registered users, but importantly, over 1,355,000 QR codes are now on display for people to scan into. But I think as a country, we've all gotten out of the habit of doing that. So my message to all Kiwis is keep playing your part as the team of 5 million. We do want to see people scanning in, keeping that digital record so that if they need to go back to it, they have it.
Are you planning on any other solutions? You know, some researchers have said it's not good enough. Kiwis have got relaxed. Is this because you're holding back on public messaging and advertising because you're waiting for another solution and you're working on that behind the scenes? No, look, the QR code system is a good system. Obviously, it's not being as widely used as we would like to see it being used. So we'll keep pushing on the QR code system.
Meeting of the Southern District Health Board this morning, they were talking about Queenstown being used for isolation quarantine. They put it at the bottom of the priority list below, I think, Dunedin and Invercargill, because they say that they don't have the health facilities that are required. Is this a situation where basically a whole heap of Queenstown hotels are going to go begging because the health network isn't up to scratch there?
I wouldn't say it's not up to scratch, but I would say there are a number of factors that have to be taken into account when considering where quarantine or managed isolation facilities can be set up. The presence of public health teams is one of them. The presence of capacity within the local DHB is one of the criteria that gets considered. My colleague, Dr. Woods, is working very hard with Air Commodore Webb to scale up the number of managed isolation and quarantine facilities that we have. And I think there's about another 700 beds coming on stream this week. And we'll keep doing that as quickly as we can to add more capacity.
Just to clarify on that, I mean, Queenstown obviously is in sort of dire straits at the moment in terms of tourism and all the rest of it. They have all of these hotels. So is Queenstown going to be ruled out as from having these facilities because they don't have that hospital level care?
I don't think, I never say never. I think what Dr. Woods and Air Commodore Webb are looking for at the moment is speed. So they're obviously looking to set up managed isolation and quarantine facilities in areas where they can do so quickly. But with the passage of time, it may well be that there are a range of additional facilities that may be pressed into use, including potentially ones in Queenstown.
How much does hospital level care actually matter? Because how many instances do we actually have of people who are in quarantine and isolation requiring hospital level care while they're in the facility?
I don't think it's just hospital level care. There's a variety of things. There's what public health support is available for those facilities, testing, and the proximity to testing and the speed of being able to turn around testing results. There are a whole variety of different things that come into play here, and I know that the team are working as quickly as they can to scale up the number of beds that are available. Yes.
What's the latest on the COVID card concept?
Look, it's still I believe it's still under consideration. Obviously, the focus at this point is the QR code testing.
Seen a physical prototype or anything of the technology, or is it still in concept?
My ministerial colleague, Chris Farfoy, Minister for Government Digital Services, is working on that at the moment. I have not seen that yet. I don't know whether he has seen a prototype yet.
Or 4,000 at the border that you're saying for testing, is that in the community or is that in total, including testing at the border?
Look, I think it's a balance of both, but I think we certainly want to see a higher degree of community testing than we're seeing at the moment.
That level of testing we're talking about today, 1,640, that includes all of that testing being done at the border. So actual testing in the community is substantially lower than that.
That's right. So I can give you the number of tests that were at the border, because 505 of those 1,600 tests were tests of people who are in managed isolation and quarantine. So, or they were tests conducted at managed isolation and quarantine facilities. So that leaves around 1,100, just over 1,100 in the community, and that's certainly not the level of surveillance testing that the government has been advised we'd be wanting to see, just to give New Zealanders the level of reassurance that they are looking for.
How soon would it be your expectation that officials would be able to ramp up the amount of tests to 4,000? Are we thinking days, weeks, months, or what's the timeline?
Certainly days. I would not be willing to wait a long period of time for that to happen. And I've made that message very, very clear to them, and they have accepted that message, and they're getting onto it.
The DHB's set out their surveillance plan for level 1 weeks ago. Why is that surveillance testing not happening?
Well, that's a question for them, and it's the question that I've asked them. I asked them this morning. I'll be frank with you, I have not yet had a good answer as to why those numbers have come down in the way they have in the last few days. It is not meeting the expectations that Cabinet has set out in the testing and surveillance plan that they put to us. So, I've made my expectation very clear. We've agreed a plan with them. I expect them to be implementing it.
First time The Health Ministry said that they'll be doing something and they appear not to be doing it, however.
Yeah, look, again, I'm not going to go back and second guess what they issue in terms of clinical guidance. That is a matter for them. But if the clinical guidance that they have issued has resulted in this significant drop-off in testing, then of course that's something that they'll need to look at again.
Have they not been doing it for now?
Sorry?
How long have they not been?
We saw a decline in numbers towards the end of last week, so relatively low numbers over the weekend, slight uptick this morning, yesterday, but still not the sort of numbers that we have been experiencing and expecting.
So are you saying you expect them to revise again that clinical guidance to make it more loose?
Well, look, I think they need to look at why the testing rates aren't the level that they have advised we should be seeing.
Is this a mess? Is this a bit of a mess left over by the previous health minister?
No, I don't think so. I think, look, any minister, whomever the Minister of Health is, would be watching this on a daily basis, monitoring it very closely, and making sure that if anything came up, i.e. lower testing numbers than we were expected, that appropriate action was taken.
So were those numbers only picked up and decided that it should be a priority at the last cabinet meeting, or has this been for a couple of weeks and it's just been let go and now you're looking to remedy it?
No, look, I can tell you that the Prime Minister and the previous Minister of Health have been monitoring this on a daily basis. The testing and surveillance plan was signed off by Cabinet about a week ago, and since that time we've seen this reduction. It doesn't meet the expectations set out in that testing and surveillance plan.
There appears to be an increased focus on well-being at the border facilities. Is that in response to the attempted escape?
Look, I think everyone needs to acknowledge that being locked up in a hotel room by yourself, potentially if you're by yourself, for 14 days can be very challenging, particularly given that some of these people will have had difficult journeys to get here. It may have taken them some time to get here, it won't have been easy to get here, and they may be coming home for reasons that are very difficult. And so we do have to acknowledge that some of the people who are in these facilities will be very stressed, and we've got to make sure that we're supporting that appropriately.
Was that in a direct response to you realised how bad it got when someone tried to escape? Is that what has spurred this increased focus on?
No, I think it probably means we're talking about it a little bit more. That certainly brought it to the public's attention more, and I do want the public to have a reassurance that we are providing support to people where they need it.
Has any thought been given to using cruise ships for quarantine and isolation?
Look, I think Megan Woods and Air Commodore Webb are looking at all of the available options that might be out there. There are a whole lot of things that you need to consider. Obviously, security of the facility is one of them, making sure that people have a safe way of exercising and getting fresh air, making sure that they're getting natural light on a daily basis, all of the things that you might expect. All of those things need to be taken into consideration, making sure they're not having to use shared facilities, so rooms with en-suites rather than shared bathrooms, for example.
Off the table, though, cruise ships?
Look, I think everything's on the table at this point, as long as it meets the relevant criteria. And
how many people can we handle in quarantine ultimately? You're increasing it, but at some point there's only so many hotels with en-suites, and how much can you get to?
Look, I can tell you that the effective capacity that we have today is 6,378, and we have 5,787 people currently in occupancy, and we're adding new beds as much as we can. We do have a responsibility to ensure that New Zealanders who are returning home can return home, and obviously we're looking at ways that we can help to better predict when people will arrive, so that we can be better planned, better plan for that. But I don't think there's any appetite in government to shut off that ability for people to come home.
What does that mean then for employers and those who are hoping to get people in with work visas, or people to come home who are stranded outside with work visas, let alone tourists? If you're saying we're sort of maxed out now for New Zealanders coming home, it doesn't seem like a lot of room for anyone else.
Look, as we continue to expand capacity, that'll obviously help us to process the returning New Zealanders more quickly, in the sense that, the greater the number you can do at any given time, the faster you clear that backlog of returning Kiwis, and therefore the more space that gets opened up in the medium term for other people who may need to be coming into New Zealand, including those who are on work visas and so on.
Room for 6 Britons to help with the New Zealand First campaign?
I've got no idea what that's about, and I'll leave that question to New Zealand First.
Would there be
in terms of the longer term strategy around managed isolation, obviously this issue isn't going away for some time, and once returning New Zealanders come back, as Bernard suggested, there'll be a bunch of other useful people who will, would like to come here. What is the longer term strategy and thinking around this?
Yeah, so look, as you can imagine, at the moment, a key focus is dealing with the immediate pressure that we have at the border, making sure that New Zealanders who are coming home have a bed, have a room, and can be isolated when they arrive back in the country. Obviously, we're looking at how we can increase that. We are looking at alternatives, including, we've talked about international students, what might be done differently for international students cohorts coming into New Zealand. But we want to step through that very, very carefully. I don't think anybody involved in discussions around what's happening at the border wants to see COVID-19 inadvertently spread through the community because we moved too quickly to scale up things like international student accommodation before we were ready.
Testing plan that Cabinet signed off a week or two ago, it spoke about testing of airline staff, airport staff, hotel staff. How far has that testing started? How many people have been tested?
What I've asked, and the health officials are making a coding change. So at the moment they code based on tests that are taken in the community, and they code based on tests that are taken in managed isolation and quarantine. And the tests of staff at the border will fall within one of those two categories. They are changing their coding so that those people will be coded separately, and therefore we'll get a breakdown on a daily basis of those tests. And that will just give us more confidence. The testing is happening, but it's not being separately recorded. So I've asked for it to be separately recorded so that we can very clearly see how much testing is happening there.
Not tell you the number then? Have you asked for it as the Minister and they haven't been able to tell you?
No, because in some places they'll be going to an MIQ facility to be tested. In some cases they'll be going into a community facility to be tested. I've been very clear that I want to see that breakdown, so they're changing their coding so that they can give us that breakdown.
The people from isolation are going into community facilities to be tested rather than...
No, these are people who are otherwise exempt, so people who are working at the border, for example, who would be wearing PPE during the day and so on, would be observing all of the requirements to stay safe. We're still asking for testing to take place there as a precaution.
Do you consider New Zealand still to be truly on its elimination path, given that all our cases are in MIQ facilities, there's no local transmission, but one of the caveats of that was that there needs to be sufficient suitable amount of testing. And if we're dropping off in that testing, does that threaten where we are on our elimination path?
No, it's not a reason to be concerned, but it is a reason to be vigilant. And so we are in a very good position. There is still no evidence of community transmission in New Zealand. The reason that we want to keep those test results up a bit higher than we're seeing at the moment is just so that we can have that level of confidence. We have no reason at this point to believe that there is any community transmission in New Zealand, but we want to be able to provide that level of surety and that level of certainty to New Zealanders on an ongoing basis. And so the advice that we've had is that we need a slightly higher rate of testing just to provide that backstop, that reassurance. I'll take a couple more questions. Bernard.
Yeah. What other options do you have to limit demand, aside from telling New Zealand not to selling tickets?
Well, one of the things that we are looking at is whether there should be a booking system, for example, so that people are booking their position in managed isolation before they board the flight back to New Zealand, so that we can better forecast when people are arriving and we can be prepared to accommodate them when they get here.
Will you eventually have to have some sort of quota for how many people can, apply to get into New Zealand?
Well, I think a booking system that better, joins up when people are likely to be getting on planes with the capacity to receive them in New Zealand is a very significant step. And if we can get that system up and running, that's something that, again, Megan Woods and Air Commodore Webb are working on at the moment.
You mentioned just in the last 20 minutes about 3 things that you've sort of had to review or change or fix. Is it fair to say that coming into this role last week, things weren't at a gold standard, things weren't up to scratch, and you're cleaning things up effectively?
No, I think a fresh set of eyes is always going to ask different questions and have different requirements. I want to be confident that every time I stand in front of you, I can answer all of the questions that you might have. There are some gaps in the data, for example, the one that we just canvassed about testing rates and where the testing is taking place. And I want to be able to answer those questions fully. So, of course, I'm asking a lot of questions.
Those assurances that have been given for months now around gold standards of things, were they actually accurate, given you're now having to fill the gaps, as you've just said?
Look, I'm not going to go back over the history. What I'm saying is, as the Minister standing before you now, who has to answer all of your questions, I've got a number of questions that I've asked for better information on so that I can do a better job of that. I'll take last question up the back there.
Have you asked for legal advice on trying to match people coming back to New Zealand into an MIQ facility? Surely a Kiwi's legal right to return home doesn't depend on whether there's a spot in the hotel.
Look, it'd be fair to say that we get legal advice all the way through around the different decisions that we're making around processes at the border.
Legal concerns about that in particular?
Look, I'm not going to get into the legal advice that we receive, obviously, but we consider all of the legal risks that are involved in any of the decisions that we make and ensure that we're, mitigating those risks. Thanks very much, everybody. Cheers.